And the Serum Institute of India has clarified on the controversy over the pricing of Covishield injections. The Serum Institute has said that Covishield remains the most affordable vaccine. It says that it's inaccurate to compare this price of vaccine with other global vaccines, and that Serum Institute of India says 600 rupees per dose is only to private hospitals. As far as the government vaccine is concerned, or delivery to government is concerned, it's 400 rupees. The price of Covishield for government's immunization program is the lowest anywhere in the world. I quickly want to cut across to India Today's Sneha Mordani for more on this big story. Sneha, bring us details of the controversy and the clarification.
Yes, absolutely, Gaurav. In fact, concerns have been raised right from the very beginning when Serum Institute of India CEO even spoke to India Today, talking about the fact that he's going to be selling the vaccine at 400 rupees a dose. In fact, there was a bit of confusion whether this is the price that's going to be given, at which the vaccine is going to be given to the center as well. But let me tell you that the center today, the Ministry of Health and Family Welfare, has clarified, saying that this is not the price that they're going to be buying the vaccine at. They're going to be buying this at 150 rupees per dose. That essentially remains unchanged. This after Congress leader Jairam Ramesh raised questions about why there are different prices at which the vaccine is being sold to the center and different prices to the states, raising questions on differential treatment. Which state is going to procure the vaccine at which cost is going to be then single-handedly be decided by the Serum Institute of India, which is not a fair deal. It's what the Congress said. Not just that, others also raised these questions on why a vaccine which is made in India, remember it is being manufactured in a big way in India, in Pune, in the Pune facility of Serum Institute of India, be so expensive. It's costing about more than $5. And that is actually the most expensive vaccine in the world against COVID-19. Also remember, this is the vaccine which is going to be in the market, and no other country is selling its vaccine at present, like India is going to start to do so, to states. And then states are going to be, of course, giving it to the private hospitals. That's going to be the procurement process. The deal here is that Serum Institute has clarified, coming out and saying that we need this money right now. Their is that the situation is rather uncertain, and they've said this in a press statement that they've put out, that the situation demands that they be prepared for a situation where the virus is mutating and where they could be required to not just ramp up production, but also look at developing a vaccine in such a way perhaps to meet the new challenges.
But there's different pricing. So 600 for the private sector, for private hospitals, is one set of pricing. But what is the clarification on two pricings, 150 rupees for the center and 400 rupees for states?
Yes, absolutely. The clarification is what they're saying it is right now, that they need this money. Gaurav, they're saying it as if this sort of an input, in the sense, in this financial input, to then ramp up our production even further because the situation is uncertain. In fact, they've gone on to say this as if that we need this money. They've also said that the virus is mutating. Now the reason why that they are selling this to the center for 150 rupees a dose is because they have had this deal a while ago, and this is a deal that stands. The negotiation with the center and with private players has been, according to what they say, is justified right now because they are unsure of the near future. The center has also, however, clarified in that tweet, Gaurav, the Ministry of Health, saying that 150 rupees a dose is what it stands and free of cost to those taking it at the government hospital. So nothing remains changed. The Serum Institute has obviously said that at this point in time, we feel that 150 rupees a dose is a special price, is what Adar Poonawalla has said time and again, giving it because we are in the middle of a pandemic and they need to step in with the center trying to inoculate as many people as it can. But states have to pay a new price for it because the situation is very different from what it was about 2 months ago when this deal was actually done with the government of India, and hence the new prices.